My name is Drew. I'll be answering the questions for week 4, 1 through 4 on MRI 320. For number 1, gadolinium is a substance that is put into a patient that enhances appearances on pathology, and it helps the MRI techs and radiologists read the images more clearly. The major concerns would have to be impaired kidney functions, allergic reactions, and complications of an IV. For the impaired kidney functions, we would just have to make sure that the amount of creatine is up to par. If the GRF rate, or which is the glomerular filtration rate, is above 60, it's healthy, and if it's below 30, it's impaired. For allergic reactions, they hardly occur, but if that's the case, just explain to the patient that there's some allergic reactions that might happen, like swelling, redness, itchiness, a difficulty of breathing, and a drop of blood pressure. And if that's the case, just have the patient stay behind, and we'll watch over them until there's no sign of allergic reaction. But there is something called a delayed allergic reaction, and that's where a patient leaves the facility and ends up getting an allergic reaction way before not way before, but after they leave the facility. And if that's the case, they would have to visit an emergency room. And the last one would be complications of an IV. There's 3 complications. The first one would be infiltration, and that's when leakage of blood is coming out of the vein when an IV is put in, and that can be very painful and can be very fatal as well. The second one would be infections. The only way a patient could get infected if the supplies aren't sterilized properly. The tech isn't wearing gloves when using those supplies. You just have to make sure that the patient's skin is also cleansed, and making sure that the hubs are cleaned with alcohol wipes about 15 seconds, or for about 15 seconds. That's a way to keep the patient from infection. And the third thing would be air embolus, and that's injecting air into a patient, and that's very harmful and can be very fatal as well. Just make sure that the tech is pushing out air out of the syringes before injecting the IV. And sometimes some techs would push out the liquid of the contrast out, just to make sure that all the air is pushed out of the syringe. For number 2, the 3 main slices would be coronal, sagittal, and axial. For coronal, the body is divided into sections from top to bottom, which is anterior to posterior. For sagittal, it is divided into sections from side to side or from left to right. And for axial, it's divided into sections from front to back, superior to inferior. MRI protocols include sequences in multiple scan planes, only because the scan can be used or is being used to find a certain body part, so you would have to make different planes to get different images of the body part that we're trying to scan, and just in case if there's any pathology in a different area of that body part, so a different plane can can change the focus on what we're looking at, and can help us a little bit better. Number 3, protocols. Protocols are like the shopping list of sequences that have to get done before a patient leaves the facility. What's the second question? They're used because each body part has a different protocol. For instance, in the brain, just scanning the brain and the IACs is different, because the IACs are smaller. So maybe you would have to do a smaller field of view just to get a closer look on the IACs, and just to make sure that everything's okay there, compared to a brain where it's a bigger field of view and you're just getting a wider image of that. And then for the last question, why take notes in clinicals? It's important to take notes in clinicals because every facility is different, and also the techs, they might want a different protocol for a brain compared to a different building, and you just want to make sure that you're on top of that, and you don't want to rely on the tech to always giving you answers and trying to figure out how to like do certain parameters or certain sequences. You just want to always look back to your notes, and it just shows that you're independent, and then that you're gripping the information correctly. And yeah, thank you.